There are certain mythologies attributable to Ozempic or semaglutide, and we need to answer those queries and those problems as well, because myths are false beliefs which do not occur in reality but only are heard and thought of, so we need to tackle those mythologies. One of the biggest myths regarding semaglutide or Ozempic is that it causes cancer. Well, actually that's not the case. Over so many, in thousands of patient clinical trials, we have yet to find out a clear-cut association between Ozempic or semaglutide and cancer. It does lead to one multi-endocrine neoplasia, which is known as medullary thyroid carcinoma. So in patients with medullary thyroid carcinoma, only those are the patients who should never be prescribed GLP-1 receptor agonists, including semaglutide or Ozempic. Otherwise, there is no clear-cut evidence that Ozempic leads to cancer formation. When it comes to vision loss, we know that there are clinical entities like optic neuritis, which occurs because of glaucoma, which occur because of diabetes, which occur in patients who have got very crowded optic disc, which occur in patients who are elderly. One of those conditions is NAION, or non-arteritic ischemic anterior optic neuropathy, which is the second most commonest optic neuropathy after glaucoma. But despite of being the second most commonest, it is very rare, occurring in less than 0.01% of the patient population. We have data, conflicting data from the Western world, especially the United States, in which there was a person by the name of Hathaway. He showed in his clinical trial that NAION, or this kind of optic neuropathy or sudden vision loss, is common in patients with semaglutide or Ozempic. But the US Health Network, comprising of 16,000 patients and more, who were also put on Ozempic, they found out that there was no clear-cut association between Ozempic and vision loss. So NAION, or sudden onset blindness, can occur in people who are not taking Ozempic, belong to the normal population, and it can also occur very, very rarely, that is 0.01% of patients who are taking Ozempic. So yes, Ozempic can lead to vision loss, but the rationale or the occurrence is very, very negligible. Keeping in mind the cardiovascular benefits, keeping in mind the cardiometabolic benefits, one should never stop Ozempic or semaglutide only because he or she is scared of developing sudden onset blindness, because the benefits tremendously outweigh the risks.